Oh, hey! You must be our new intern. I'm Genevieve. I do intake. Ellie, this is the intern we've been waiting for.
Oh, hey, we could really use you around here. I'm Ellie. I'm one of the vet techs.
Nice to meet you. My name is Joaquin. It's really good to have you on board. Listen, I'll go tell Maddie you're here.
So anyway, we have a dog in too.
Okay.
Oh, so you must be our new intern. Welcome to Legacy and congratulations on completing your education. Now you're ready for the real thing. It's a tough road to hoe.
Welcome to Legacy Animal Hospital. I'm your supervisor, Dr. Maddie. I'll take you through the hospital and quickly show you the ropes. This is the reception area. This is where you'll find the whiteboard, which shows the status of new and ongoing cases. Click on the whiteboard to select your case and begin to work on the patient. Before you select your case, you might want to take a peek at the research computer. You can find all of the information for successfully treating a patient here. When you are treating your patient, you can find the research for that case right on the PDA in the info menu. The PDA can be a good old chum. It has two menus, Action and Info. There are two types of rooms, treatment or trauma. The trauma room is usually reserved for critical cases. You can get to the treatment or trauma room using the action menu of your PDA. First and foremost, remember, it's always important to get the patient stable. A tool that will stabilize a patient could be on any tray. Select Tools in the Action menu of the PDA and you will see an explanation of each type of tool tray. You can mouse over the text description and see an example of the tools. Your patient's health status is updated every time you do a procedure. When you finish treating your patient, access Sign Out on your PDA. After each case, I'll review your progress. I'll be honest and fair to make sure you deliver the best level of care. Do a good job and you'll be entrusted with our most precious cases. Be sure to take a load off sometimes and play the trivia game in the lounge. You can also get here from the action menu on your PDA. Remember, we're all counting on you to perform at the highest level of professionalism.
I'm worried about Chili. She's been drooling for a few days, and every time she tries to eat, the food just falls from her mouth. I can see that she's lost some weight. She's even had some diarrhea.
How old is she?
She's 5. I've had her ever since she was born. She's never been sick before. Please, help her as best as you can.
Oh, of course we will. Try not to worry.
Think. What might cause something like this? Poor girl. Nobody deserves this. Aren't you just in love? God, what a cutie. Drool. My life is full of drool. I know. It'll be okay. Well, it's good news and bad news. No parasites, but some diarrhea. Look at the size of those molars. Poor baby. Just hang in there.
Do carry on. Quite a slick performance.
This chinchilla has a common problem known as the slobbers. His teeth have continually grown, and now they're so large he can't eat. His teeth need to be cut down in dental surgery, and then his normal eating will resume and solve the bacterial problems in the process.
Okay, we got Scotty, a 2-year-old terrier mix. Spunky little Scotty here tried to catch a frisbee at the park this morning, but he landed with a yelp, and his right front leg has been useless ever since. Since he's on all the appropriate preventative medication, it seems pretty straightforward. You should be able to handle this one. It's too bad playing frisbee can be this dangerous. Terriers are such an eclectic breed. Poor baby. Just hang in there. This dog's respiratory functions are all normal. He was as playful as usual before the accident, but I guess that's obvious since he's here. Very precise. Impressive. Masterful work. Scotty will be back in the park soon, thanks to your efforts.
Stunning performance. You really know your stuff.
As his owner might have guessed, Scotty broke his leg. Luckily, it was a mid-shaft fracture, meaning his new cast should be able to repair the damage over 6 weeks, rather than having to put him through surgery. We'll keep him overnight to be sure his cast fits him properly. After that, his owner needs to restrict his activity and bring him in for follow-up examinations to be sure the cast is doing its job. Fuzzy is actually a small iguana. He ran into a tree branch in his brand new habitat, and now his eye is swollen shut. His skin tone has gotten darker after the injury, but he is responsive. His owners made him a new, larger home, but it only stressed him out. He was as playful as usual before the accident, but I guess that's obvious since he's here. Fuzzy's so little, but you can already tell that he's standing tall. It's important to do your research into proper habitats for any pet. This should do it. Open wide, little guy. Wasn't that wondrous? That's a pretty nasty cut. You did what you had to do. All doctors have to be brave. I feel bad for the owners. They thought this cage would help Fuzzy, and now look at him. The compress will cool him off. This medicine will get him on the way to recovery.
Bravo! We definitely were right on target hiring you.
Fuzzy has a corneal, or eye abrasion, as a result of an accident with a tree branch. The cornea of the eye is very sensitive, so any scratches need to be treated carefully and thoroughly.
Nurse! Oh, can you help me? It's my Duchess. She won't open her eyes. Oh, can you help me?
Okay, just calm down and tell us what happened.
Well, I was giving her her evening bath before bed per usual, and I ran out of the feline finesse. So I used dish soap. Here, smell. It's aromatic, isn't it? But it's deceiving. Anyway, I was drying her off ever so delicately, and she started to squint just like that. And then she started to claw at her face, sort of like Patty Duke in The Miracle Worker. Oh, my baby, now she won't open her beautiful eyes for her daddy. Come on, open your eyes for your daddy.
Don't you worry. We can handle this.
We'll go check her eyes.
Please, excuse my appearance. Everything I have is in the dryer. I had to rush right over. What is this, my SATs? I told you everything I know. Look, I'd like to stay here and chat, but would you just stop at the 3rd degree and work on my Duchess? You're the doctor. You tell me. Does she look normal?
I'll be sure to tell Maddie about this. She's slobbering because of the soap. Achoo. Oh, must be doing something right, because my sneeze is getting worse.
Such a good little girl. Easy, baby. You be Scooby Dooby 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 Dooby. We're very close.
The green spot makes him look like an alien cat.
Poor Duchess. Daddy's so sorry. Yes, my sweet baby.
You have given sight back to my Duchess. Next time, I promise only to use pet shampoo. You're a cat saint. Amen.
I'm not sure what to say. Such brilliance!
Cats like to clean themselves for a reason. In this case, this cat got soap in her eyes, causing a corneal erosion, which means her corneas were chemically injured by the soap. She'll be fine after some pain relievers and antibiotics.
Spike's downright stinky, but he doesn't seem to be aware of this. He plays and eats normally, and his owners can't understand why he smells so bad. But there's no mistaking there's a problem here. That's a lovely odor. I love it when the office turns into a sewer. Who would have guessed an infection with that odor? You'll be assigned more challenging cases in no time. Breathe in. You've got this guy covered. Think, what might cause something like this? Just call you Sherlock Holmes, because you've got this mystery under control. Excuse me, I just need a quick breath of fresh air.
Bravo! We definitely were right on target hiring you.
Spike has developed gum disease and a severe tartar buildup after a lack of dental hygiene. He is on antibiotics and will receive dentistry under anesthesia tomorrow. And then his owner must be educated on the necessity of consistent dental care. Cindy's a bullfrog who lives in a school science lab. Despite what you might be thinking, she's usually well cared for. But now her skin has become discolored, which can probably be attributed to some kids who didn't know they had to change the filter several times a week. Fix her up right, Doc. I don't think these kids could take losing her. The skin discoloration is red and off-white. What are those patches? Looks pretty infected. You know that teacher is probably feeling worse than the students about this. She's the one who brought Cindy to us. Poor girl. Nobody deserves this. You're something else. Good job. You got a knack for this stuff. I just know that teacher is happy that you're treating Cindy. Look at her. Cindy is such a good sport. She's prodded by students and doctors, and she's still so good-natured.
Do carry on. Quite a slick performance.
I'm sure Cindy loves all the students at her science lab, but unfortunately, her caretakers forgot to give her the full attention she needs. Because the filter and water in her tank weren't changed, she got a fungal infection as a result of the increased amounts of bacteria and fungi in her water. With antifungal treatment, she'll be back to normal soon.
Pele is a sprightly border terrier with a real affection for camping and hiking with his owner. He came back from this last hike with a severely swollen face, which his owner noticed just after they got back to the car. He gets his regular shots and medicine. Be thorough. Be sure to pay attention to follow-up here. They go hiking quite often. Pele's swollen face was not obvious until they were in the car. How quickly can swelling occur? He's swollen all over. He eats commercial dog food. How did you know the perfect thing to do? That temperature is too high. I'm in awe. He's an active dog, and he gets all of his shots. You are such a tireless worker, and look, it pays off.
Stunning performance. You really know your stuff.
Pele was stung by an insect on his hike, and now has an allergic reaction. It's not serious, and he's been given antihistamines. His owner's been told to keep him away from stinging insects from now on.
Hi. I was in here once before with my dog, Bosco. He's here now.
Good.
Anyway, Tweety here is having some sort of problem.
What kind of problem?
Well, her beak has this odd crustacean, and now the beak seems misshapen, and she's scratching at it.
My dog Bosco loves Tweety. They're so cute the way they play together like brothers. I need help, don't I? I don't think so. I was more worried about how he looks. No, but I didn't want to poke him too much, just in case. Well, he looks kind of, I don't know, dry. I got back.
See? Your instincts were right again. I know. It'll be okay. What does that crusting mean?
Bet you see a lot of wackos and their pets, huh?
I gotta say, you're not bad with exotic pets. The lab found these mites. They said you could see them on the slide.
Poor little guy. It looks so painful.
This should get those mites in order. Pretty good. Pretty neat. This should get those mites in order. This should get those mites in order.
You're such a whiz!
This budgie parakeet wet his beak on some contaminated water in his cage. This caused facial mites and an infection that causes diarrhea. He's lucky in one respect, though, because the itching of this infection is lessened in budgies. Sarlacc is a 5-month-old kitten with an unseemly problem. She's developed a scaly spot on her face that continues to spread. Her owner's toddler son has developed red marks of his own, and they're worried that the boy got it from Sarlacc. She's had all her shots and came from a breeder. He said the spot was a lesion from play that would go away. It hasn't. See what you can do, and please keep me posted on this one. Sarlacc is this family's only pet. Look at that infection. The pulse is normal. It's too bad you don't treat humans. I'm sure they would entrust their son to you. I'm sorry, I have a bias against breeders. We just have such an overpopulation problem. What's the reading on that? Hey, that's showing some spunk. We should definitely take a culture. I really hope you can manage to keep up this level of care. This test should tell us something. At least there's no parasites. This medication will help. Oh, those breeders. Greed shouldn't be allowed to make kittens and little children sick. Thank goodness. Now Sarlacc and her family can finally enjoy a healthy life together.
I'm not sure what to say. Such brilliance!
Sarlacc has ringworm, a ring-shaped lesion on her skin caused by fungi feeding on dead skin and hair cells. She needs to be isolated and handled with gloves by her owner until her cultures are negative, even if her skin looks clear. Sarlacc has been given medication and antifungal treatment, and now her owner will need to dip her in a lime sulfur dip each week.
Little Samba here is a brand new adoptee, just 5 days in her new home. Since the day after her adoption, she's been coughing like crazy. The shelter told the owners that the coughing was a side effect of her being spayed, but they're worried the shelter gave them a sick dog. Poor Samba, only 5 days in her new home. The pulse is normal. If she were human, you could feed her ice cream after this. Your preparation really paid off, Doc. Good move. She should be back and enjoying her home in no time at all. Very professional attention to detail. At least there's no parasites. I'm gonna call that shelter after this. Let's get that blood test to the lab. Stat. Whew, that's a lot of fleas. She was also vaccinated at the shelter, but they don't know anything else about Samba's past.
Such a stellar performance for your first year. Congratulations. However, I won't carry on. You've still got a long way to go. Be thoughtful and thorough, and you'll go far. Bravo! We definitely were right on target hiring you.
Samba has kennel cough, a common form of bronchitis for animals living in animal shelters or pet stores. Poor ventilation in these places usually causes this, and it may go away by itself in a week or so, but we've given him medication to ease his coughing anyway. He also has fleas, which are being managed. Follow-up in both cases is necessary if the problems don't subside.